Morning, everyone. I would like to thank all of you for coming to our NNI Stroke Awareness Day. And on this beautiful Saturday morning, I would like to share this topic on supporting yourself and loved ones after stroke. Okay, so stroke is a very difficult journey for the stroke patient and also the family members. So we will be here to support you through the journey. So the contents that I will be talking about includes the journey of stroke in Singapore, the common issues faced after stroke, and also how to support your loved ones and yourself. And we will talk about our post-stroke discharge checklist and what are the support that we have in the community. Okay, so this picture over here shows the national statistic of stroke over the last 10 years. So we can actually see that in year 2010, there were 5,000 plus cases. And in year 2020, the cases actually rises about 3,000 plus cases. And what is more concerning here is that we tend to see young strokes happening in the age group of 40 to 59 years old. Okay, so building on Dr. Joanne's talk earlier, so the journey of a stroke patient can be divided into three parts: the pre-hospital, the in-hospital, and also the post-hospital part. So the first part is when the patient actually brought in by the ambulance, and then there will be a group of doctors who actually see them in the emergency department. So this is where they are actually seen and screened. After that, we will do a brain scan to see whether they are actually eligible for what we call as acute stroke treatment, to either dissolve the blood clot, or actually we can go in through the blood vessel to actually bring it out. So if they are not, then we will actually bring them to the acute stroke unit for further treatment, whereby you can see a group of doctors, nurses, and therapists. We will do rehab before they are actually returning to community. Now, after discharge, the next question is, what is next for you and your loved ones? So again, just now we emphasized a lot of risk factor controls. So what are the risk factor controls? This includes things like high blood pressure, high cholesterol, diabetes, and also what we call as atrial fibrillation, which means irregular heartbeat. So you realize that after a stroke patient is discharged from the hospital, they are actually given a list of medications to bring home to better control their risk factors. And besides controlling risk factors, taking all the medicine, that is actually not enough. So we have to do more things to actually make our life better after stroke. So what happened is we strongly discourage smoking. Why? Because smoking can also cause stroke. It can also cause a lot of heart problems. And then we say no to excessive drinking. And we have a goal-directed weight. So we check our BMI regularly. And also what is important thing is we take in a healthy diet for our daily food. So you can refer to this picture. So this picture actually shows that half of the plate is consisting of fruits and veggie, where the other half, 1/4 will be your carbohydrates, which will be your rice, brown rice, or bread. And the other 1/4 will be your choice of meat, whether you like fish, you like chicken. Yeah. For more information, we can actually refer to Health Promotion Board. You can just type Health Promotion Board, healthy plate. When you Google, then you can see this picture. Okay, so the next question is, how may stroke actually affect you and your loved ones? So this is our brain, and brain, we have different parts of our brain that controls different part of the body, and they have different function as well. And it's like a supercomputer that actually controls simple things like breathing, moving, to thinking, and also feeling. Okay, so the next question is, what are the potential changes that might happen after stroke? So these are the few things that might happen after stroke. This includes things like perception, communication, vision, how we see things, physical control, and also mood, behavioral, and personality changes. Okay, so what about perception? So perception is actually our ability to take in information from the world and make sense of it. So the way a person is able to perceive what is around them can be damaged after a stroke. So things like ignoring one side of the body, judging distance and dimension or position, direction, they may lose a sense of direction. Touch may feel different when they even like simple things like hold hand or body image, and certain things and object they might not be able to recognize as before. Some of them may also lose sense of time. They cannot keep track of the time of the day and the date, and some even suffer from poor memory and attention. Okay, moving on, we have problems with communication and vision. This is also a very common problems after stroke. So about 1/3 of stroke survivors actually have problems with speaking, writing, and reading. So they have problem understanding day-to-day communication. So the next thing will be vision. Vision, they may have things like blurred vision, double vision, or in cases of a severe stroke, they may have a vision loss. Okay. Physical control may also be one of the problem after stroke, and not just confining to moving arms and legs. So it includes performing purposeful movements. They have unusual movements and also clumsiness. Some of them may have swallowing and eating problems. So they find swallowing difficult, chewing difficult, and also things like when they eat, they tend to cough or choke more easily. So things might be very simple for us, like eating. It can be really challenging for stroke patients. So the next problem that related to physical control might be bladder and bowel function. Some of them after stroke, they find it hard to control their bladder and also bowel, whereby they have constipation or incontinence. Okay, so mood, behavioral, and personality changes might also be one of the common effect of strokes. So mood will be changes like fear and anxiety. Some of them may feel anger, impatience, irritability, loss of self control, and also they have this lack of motivation to carry on. Some may have behavioral and personality changes like loss of ability to learn from experience, emotional changes, and also a loss of social awareness. So these are the areas that they might need the support with. So the first one would be depression. So they might or might not get into depression depending on how well stroke is actually being after stroke, how well is it being treated, or how well the disease is actually controlled. And the next one will be stress and fatigue. It's a very tiring process, and they will go through huge emotional changes and also changes in social relationships. So we talk about first one, how do we help them with low mood and also depression? So the grieving process after a stroke may actually lead to depression, may or may not. And the depression can actually be severe enough to affect our daily functioning, and it can actually slow down our rehab. So these are some of the warning signs, like feeling sad, hopeless, helpless, worthless, suicidal thoughts, etc. So how do we actually help and help to support and help them with to cope with depression? So we can start counseling early or seek help from a psychiatrist. And first thing first, we have to recognize that Grieving is a part of the healing process. And we encourage them to talk about their feelings. We try to change their depressed behavior and get them motivated even though they don't feel like doing it. So what can we do? We can fill them with activities or physical therapy that actually leave no rooms for their depressed thoughts. So the next thing is we can actually seek help from a professional like psychiatrists. We can seek help early. So we can also join social activities which those community center in Singapore has in order to help them to cope better with depression. Okay, stress and fatigue. So these are some of the signs and symptoms of stress and fatigue. Like they tend to be more pessimistic. They get a little anxious over little things, and even with their friends and family members around, they find it hard to relax, and they have poor sleep, and also they might not have appetite to actually eat or drink. So how do we deal with all these problems? We can actually ask them to or help them to recognize the stress, take a break. We ask them to identify what kind of activities are actually stressful for them. And for fatigue, we get enough people to actually take over care at night, and you can actually take turns to take care of the caregivers. Most important thing is we encourage them to get enough sleep daily. So a good sleep basically range from 7 hours to 9 hours per day, but that actually varies across individual. Okay, we actually have this three-piece mnemonic to actually help stroke patients to deal with stress and fatigue. So what are the three P's? The three P's will be, the first one will be pace. We ask them to think how that they can take things step by step. And then we ask them to plan out ahead, write down the schedule, what they think that they want to do first. And also we ask them to prioritize, ask them to decide which activities or tasks that are more important for them. Okay, now moving on, emotional changes, how do we help them? We give it time. Some may improve within the first 6 months. Some patients take longer, but there's a saying, time heals almost everything. Make sure that if you suffered from stroke or you see the stroke patient, in order to help them, we encourage them to speak to the doctor, speak to friends and family about it. And we have to be open, be honest. We share it with close friends and family members. And also we try to distract them or distract yourself. So we try to do the hobbies that you like, occupy yourself with some activities like reading, writing, and possibly learn some new music and things like that. How about social relationship? So in social relationship, there will be a lot of changes. So for example, a father who actually used to work and contribute might not be able to do the same after a stroke. So this might actually change the dynamic of the family. So what can we do is we try to encourage open communication. It's about listening carefully and also being honest and understanding from each other's perspective, be it the patients or the caregivers or the family members. The next thing is we want to re-establish a place in the family whereby when a stroke happens, the role in the family might change. So we try to see what other things that a stroke patient can contribute in a family to make them feel not neglected, make them feel important. And we want them to rejoin the outside world by joining the activities that we have in Singapore. And things like intimacy and sexual relationship, we encourage them to talk openly with the partner about any concerns or changes, especially body image after stroke. And most important thing, we should support each other emotionally and seek counseling early as possible. Okay, how about caregivers? So we know caregivers is a very important component and person for stroke patients. So what we want to advise them is do not take on too much. You do what you can do. We arrange for help. We seek for help. We can create a help roster and we take a break in between so that you can have more time to continue the care. And also, we strongly encourage maintaining a healthy lifestyle, like what Dr. Joanne has said earlier. We do more exercise, we control diet, we control the risk factors. Okay, moving on, these are the social and community support that we have in Singapore. So the famous one will be our Agency for Integrated Care, which is our AIC. And also we have our Singapore National Stroke Association, which is at the back there, the booth. So they can offer a lot of information of help, support for the stroke survivors and their caregivers. And also we have S3, our stroke support station. Okay, there is life after stroke. So doesn't mean that you suffered a stroke, this is the end. So we should always look at the brighter way, okay? Okay, for those who are unsure of what to do and what to update your doctors during the medical follow-up, we can actually use this post-stroke discharge checklist. You can find them on Health Hub SG, or I actually put up a link over here. I mean, if you want, you can take a picture and it can actually be downloaded either at home or through your phone, through PC or through your phone. And this is our stroke buddy app. We have put on a QR here, and we have a stroke buddy booth outside, which is station number 4. So this is a special app that we actually spend a lot of time to design. It has been on the market for a while, but I think we need more people to start using our app. And also we can spread it to our friends and family members. So we have things like post-stroke checklist inside. We have personalized advice. We have the exercise and wellness program and also blood pressure tracker. It has a lot of stroke tips inside also on how to prevent stroke. And again, I would like to remind everyone here that timing is everything. So when you see someone has face drooping, arm weakness, speech difficulty, or hard to say, or they can't talk, it is time to actually call 995 and go to the hospital. And with this slide, we have come to an end. I hope that our discussion today will not only provide valuable information, but also serve as a source of comfort and encouragement to those who are facing a tough time. And we NNI will be here for stroke patients, and we thank you very much for your attention.
Thank you, Mr. Terry Tan, for such enlightening and heart-filled talk. Please stay for a Q&A section. We would like to invite Dr. Joanne Siet to join us for the Q&A as well. Please take a seat at the front here. Mr. Terry Tan, please take a seat here. Yeah, in meantime, for those who have questions, have not posed yet, those can scan the QR code using the pigeonhole, and our passcode will be SAW in capital 2024. And I would like to pose question. I know due to the time restraint, right, we will pose a limited question, but don't worry, towards the end of the whole event, we will answer one by one through back to the email. Okay, so this is the question. High cholesterol patients who don't take statin are prone to stroke. Explain, please. Come, okay. Let's Dr. Joanne to explain.
Can you hear me? Hello? Oh, you can hear me, right? Okay, I'll take this question. So we spoke about how one of the risk factors of stroke is high cholesterol. So we want to reduce that risk by controlling the cholesterol. And statin is just one type of medication to control the cholesterol. So firstly, taking statins itself can help by controlling your blood cholesterol and therefore controlling the risk of a stroke. Why? Because it reduces the buildup of the plaques. Remember when I showed you all the first slide, there was some building up that caused the narrowing of the blood vessel. That one can be reduced by taking your statins and by controlling your cholesterol. So this is why patients who have high cholesterol and don't take statins are more prone to strokes, because the arteriosclerosis, which the plaques, right, will get worse and worse. Then there can be more and more narrowing, resulting in more and more ischemic strokes. I hope that answers the question.
Thank you, Dr. Joanne Xie. Now we would like to pose the second questions. Okay, this question actually is very common. Yeah, because we love to travel, right? Can a person with stroke travel? What precautions are required to travel?
Hi, a person with stroke can actually travel after the stroke and after the rehab. But usually, generally, we say post-stroke after 1 month is we don't really encourage to travel because the risk of another stroke, the risk of recurrence is very high. So some of the precautions to require to travel is definitely the letter of approval from doctor, to advice from doctor, and also we have to make sure that our blood test results are okay, and also the risk factors control is also doing well before we travel. Yeah.
Okay, thanks, Terry. Yeah, so as Terry mentioned, there is certain timeline, but I think we don't really look at the actual timeline per se, especially because this is a very generic question. So a stroke can be very, very devastating with a lot of physical problems. The patient may require a long rehab, or it may be a minor stroke with not much problems after that, meaning you don't have any problems with movement and everything. So everyone is different. Okay, so we don't really look at, doesn't mean that person A and person B after stroke, same thing after 1 month, then can travel. But importantly, we look at a few big concepts. Firstly, is it safe for you to travel? Are you already recovered or in a recovery phase from the stroke? Because usually in the start of the stroke, as Terry mentioned, you have an increased risk of stroke again. Your blood tests, your results may not be that well controlled yet, so your risk factors may not be that well controlled yet. You may still need more regular appointments with the doctors and therapists before you are even safe to travel. That's number one. Number two is we also are concerned about what is your risk of another stroke and what happens if it happens, be it up in the air or when you are overseas. So these are a few precautions to take. Firstly, most importantly is if you have suffered a stroke, ask your doctor, for me, is it safe for me to travel? And usually the doctor will ask you, what kind of travel are you going to do? How are you going to travel? And then from there, we will individualize to you because every person is different. If I take a bus to JB versus I take an aeroplane all the way to US, it's also different. So the things to take precaution of are also a bit different.
Okay, thank you, Dr. Joanne. Now let's take the very last questions. Okay, the question is, how do we prevent stroke knowing that our family has a history of stroke? Yeah, I think because stroke nowadays is getting common, right? So how do we prevent?
Okay, so yes, so just now there was that big, very heavy slide about non-modifiable, means things we cannot change, and modifiable, right? Unfortunately, things we cannot change are age, male gender, right? Family history, and a previous history of stroke. These things in the past we cannot change. We cannot choose which family we are born to. But we can do things to prevent our risk of stroke by changing things we can change. Okay, which are smoking cessation, right? I think I won't reiterate everything, but it's living a healthy lifestyle, controlling the risk factors that we mentioned about blood pressure, cholesterol, diabetes, smoking, and also making sure you go for regular checkups, taking the medications regularly. And a lot of this, I'm sure, I know that she mentioned that this is the last question already, and there's a lot of questions I'm sure you all have in your minds. If you are here physically, feel free to look for us anytime after this. But all those online, or if you have, you're shy to come and ask us questions, firstly, don't be shy. But secondly, if you really still don't want to come and ask us questions, it's all right. You can go online and search on the QR code that was provided on the Health Hub. It has a lot of all this information, including that on travel. So I hope this Q&A session has been helpful.
Okay, thank you. Thank you, Dr. Joanne Xie and Mr. Terry. Now, without delay, so we would like to invite our next speaker. We have Miss Yumni from Singapore General Hospital. Yumni has been a dietitian with SGH for the last 6 years. She has a passion for neurology, rehabilitation, and weight management. She finds great fulfillment in helping her patient improving their nutritional status and lifestyle. She will be sharing information on how to eat smart to defeat stroke. Miss Yumi, over to you. Hello.
Okay, hello everybody. Good morning. I'm Yumni. So as they mentioned, I've been a dietitian with SGH for the last 6 years. So I'm currently the dietitian in charge of the neurology side and also with weight management. So some things that I'll be going through today, I think Dr. and Terry just now also went through about the risk factors of stroke. I'll be focusing mainly on cholesterol and also the sodium or salt intake and the effect on stroke. And also we can do a bit of Q&A if there's time later. So I think mentioned before that like strokes account for about 8% of death in Singapore and it's the 4th leading cause of death and the leading cause of adult disability. So 1 in 5 people who have had a stroke is more likely to suffer another stroke in the next 5 years. And 4 in 5 cases are ischemic stroke. So the risk factors, like I mentioned previously, there's age, gender, hereditary, and the history. These are the non-modifiable risk factors. So these are risk factors that you cannot change. But there's also risk factors that you can change, and most of this is related to your diet. So things like your high cholesterol, high blood pressure, diabetes, an unhealthy lifestyle, and also smoking. So what is cholesterol? So every time you go and see the doctor, they will take your blood, they will test your cholesterol, but what exactly is it? So cholesterol is this waxy fat-like substance and it's only found in animal products. So your body actually produces cholesterol and that is produced in the liver, but you can also take in cholesterol, which is from your diet. Cholesterol is actually needed in the body. So you need some cholesterol and that is needed for the growth and repair of your cells. And it's also needed to produce certain hormones. It's also needed for the production of bile acids, which is used in the digestion of fats. So excess cholesterol can lead to the deposition of fats, which causes the hardening and narrowing of the blood vessels, which then will relate to the stroke. So I think this is what is most important. So you need to understand what the doctors are actually testing for. So total cholesterol, which is the total level of blood cholesterol in your body. Your HDL, which is the high density lipoprotein. So this is also known as the good cholesterol. So what it does is that it removes the cholesterol from our body to the liver to be broken down. low density lipoprotein. So this is the LDL, which is also known as the bad cholesterol. This increases, high levels of this will increase the risk of heart disease and stroke, and also triglycerides, which can be derived from fats, but also can be made in the body from excess carbohydrate or excess alcohol intake. So when you see the doctor, these are the blood test results that will come out. So what we are looking for is for HDL. Depending on what is the readings that they give you, it should be either more than 1.0 or more than 40. LDL should be less than 2.6. Triglycerides should be less than 1.7, and your total cholesterol should be less than 5.2. So remember, your LDL cholesterol is what is known as the bad cholesterol. Your HDL cholesterol is your good cholesterol, and your total cholesterol is what you need to watch out for. So then you'll ask me where does this cholesterol come from? So your high cholesterol foods, which can be found in your internal organs, so anything that comes from like things like your kway chap, all this, that's part of the internal organs. Eggs, so egg yolks contain high cholesterol levels. So that's not to say that you cannot take any egg yolks. So it's a controlled amount. And also shellfish, so your seafood, so your prawns, your sotong, your things like your lala, all these, those will be high in the natural cholesterol that is found in this. So then there's fats. What's the difference? There's visible fat, so fat that you're adding into your food. So these are coming from the oils, the butter, any of the lard, ghee, any of the fat that is found in your beef, your mutton, your chicken skin, all this. And there's also invisible fat. So invisible fat is the fat that you cannot see. So these are usually found in like your foods when you buy outside, in your kueh when they use like coconut milk, in your roti prata when they use the oil to make. These are all the invisible fat. So fat, there's different types of fat. There's your saturated fat, your unsaturated fat, and your trans fats. So basically, your saturated fat will increase your LDL level, so increase your bad cholesterol. Your trans fats will increase your LDL and decrease your HDL. So it will increase your bad cholesterol, decrease your good cholesterol. So these are the two fats that you want to try and avoid. Your unsaturated fat is what will help to decrease your LDL cholesterol. So that is the one that you can take in a controlled amount. So saturated fat, where does it come from? So this saturated fat can be found in your animal and your plant sources. So this is what increases the LDL cholesterol. So your animal sources are things like your chicken skin, any fatty meat, any full cream dairy products, so your full cream milk, your full cream cheese, full cream yogurt, any butter, cheese will have your saturated fat. Can also be found in your plant sources, so things like your coconut milk, any desiccated coconut that you add into your desserts and into cakes, the type of oil that you use to cook. So if you use palm oil to cook, that's going to be high in saturated fat, and also things like ghee, which is clarified butter. So from our food, this is mainly going to come from any desserts, noodles, meat dishes that contain your coconut milk. So things like your curries, your laksa, all these will be high in your saturated fat. Your flavored rice, so things like your chicken rice, your nasi lemak, will be high in saturated fat because of the amount of coconut milk that is added. Your fried noodles, depending on how much oil that is added in, might also be high in your saturated fat. And things like your coffee, your tea, anything with condensed milk, evaporated milk, non-dairy creamers, things like your 3-in-1 drinks can also be high in saturated fat. So unsaturated fat, so this is the one that helps to decrease your LDL, right? So there's two types lah. There's your monosaturated and your polyunsaturated. So this can be found from your plant sources and also things like your oily fish. So for example, things like your olive oil, peanut oil, sesame oil, canola oil, these are your monounsaturated. Also your nuts that you're taking in, so things like your almonds, pistachios, cashew nuts, avocados is also a good source of monounsaturated fat. Your polyunsaturated fat will be your sunflower oil, your corn oil, your walnut, Brazil nut, pine nuts, all these will be your polyunsaturated fats. So your oily fish also, things like your salmon, your mackerel, your tuna, sardines, this will be your oily fish. So this will help to decrease your LDL cholesterol. So these are the types of fishes that you should choose to eat. So trans fats. So this one is the one that helps to increase your LDL but also reduce your HDL. So these are fats that transform from liquid to solid through the hydrogenation process. These are mainly found in your fast food, your fried food, your pastries, cookies, all these will have trans fats inside. So try to reduce the intake as much as possible. So now I test you. So when you go to the kopitiam or the hawker center, roti prata, is it a good option or not? Nice to eat lah, but not for your cholesterol. So instead of choosing roti prata, what can you choose? Brown bread. So one good option to choose will be things like thosai. So thosai is a bit lower in terms of the fat, so it doesn't use that much oil to cook. But you need to watch out for the curry or the coconut chutney that they will give lah, right? So instead of your KFC, your fried chicken, what can you choose? So you can choose your grilled chicken. So remove the skin, remove the fat, then no problems already lah. And then your goreng pisang. So instead of your goreng pisang, what you can do is just eat the banana itself lah, right? So always ask for oil, ask for no gravy, then that helps to cut down the amount of fat that you're taking in. Okay, so I try to summarize the fat part. So limit your organ meat intake to at most once a month. Choose your lean meat, remove the skin, remove any visible fat. Consume fish at least twice a week, especially from the oily fish. Choose your low-fat dairy products. Include any meat substitutes, so things like your tofu, your beans, your nuts, your lentils usually are lower in fat content. And also choose your cooking method lah, right? So choose your grill, your steam, your boiling instead of your frying or deep frying. So fiber is another component that will help to reduce your cholesterol level. So these are naturally lower in fat, lower in calories, sodium, and contains most of your vitamins. So your fiber will be your 2 fruits and 2 vegetables a day. So if you're going to ask me what is 1 fruit serving, that's going to be 1 small apple, 1 small orange, usually size of your fist. That's considered as 1 serving. Papaya, pineapple, watermelon, those 1 slice that you can get at the coffee shop, those are 1 servings, or medium-sized banana. And then vegetables will be about 150 grams of raw vegetables. If not, it's about 3/4 cup of cooked vegetables. So whole grains, so your wholemeal bread, your brown rice, things like your chapati, your bihun, oats will be your whole grains also. So aim for at least 2 to 3 servings of whole grains daily. So how to increase? So instead of drinking your fruit juice, eat the fruits. Instead of your white bread, you change to your brown bread. Instead of white rice, change to your brown rice. So wherever possible lah. Right? So improve your cholesterol by increasing the healthier fats, increasing the fiber content. So blood pressure will be mainly due to the amount of salt that you're adding into your diet. So main sources of salt is actually from what we're adding into your food lah. So either the salt that we're adding in, any sauces, So usually it's about 37% that's coming from processed food and about 60% that is naturally found in the diet. So actually recommendations about 2000 milligrams a day. So that's less than 1 teaspoon of salt per day per person. So actually for the Singapore population, we take in almost twice as much. So again, your chicken rice will be high in salt, high in fat. What you can do, choose your mixed rice instead, right? So you can add in the vegetables, add in the fiber, change the rice to a plain rice. Things like your fried bee hoon from like your morning breakfast, you can choose your soupy noodles instead. Don't finish the soup, then you don't take in the salt. And things like your processed food, so when you choose your Yong Tau Fu, try and choose the fresher options instead. So I think previously they mentioned about the healthy plate. So that's what we follow. So half your plate should be your fruits and vegetables, 1/4 should be your whole grains, and the other 1/4 should be your meat products. So when you go and get your nasi padang, your cai fan, all this, right? What it should look like, it should look like this. So 2 types of vegetables, your carbohydrates. If you can change to brown rice, you change to brown rice. And then will be your meat and your tofu, your fish, all this lah, right? And then choose less of the gravy. Okay, so that's it for me today.
Hello, thank you, Miss Yumi, for the sharing with us these simple yet effective tips which empower us to knowledge to make healthier choice daily. I need Miss Yumi to stay here for a while for the Q&A. Let's see. Wait, there are many coming in. Okay, let's test this. Does drink apple cider help to lower cholesterol? I think this is a very common question.
Yeah, I think it's a very common understanding, but actually in terms of actual like clinical evidence, there isn't actually any very strong evidence. So there's no harm, but I cannot tell you if there's any benefit either, right? So not 100% to lower your cholesterol.
Okay, let's second question. What is reasonable amount of egg yolks for an adult? Because we all know that egg actually is high in protein, right? And yeah, for muscle and all those. So how much is a sufficient amount?
So when you eat the egg, right, there's the egg white and the egg yolk. So the protein actually comes from the egg white. The egg yolk is just the fat and the cholesterol. So currently the recommendations according to Ministry of Health is 3 egg yolks a week. So that's the maximum for an average adult. I think different countries currently have different recommendations. Some countries have 1 egg yolk a day is okay. So I would say it depends on your cholesterol levels. So if your cholesterol levels currently still okay, and you need the protein, 1 egg yolk a day might be okay. If your cholesterol levels start to go up, then that's something that you might want to cut down.
Okay, let's maybe you pick up the questions that you like. Because for me, everything is so important though. Yeah. So maybe let's Yumi to take that, which is for her more or less daily have been questions. Okay, Ken, for this question. Regarding soup recommendation, isn't fish soup high in sodium due to fish sauce being used?
Yes. So correct. So fish soup is high in salt, but the sodium content is mainly coming from the soup itself. So if you don't finish the soup, then the sodium will be a bit lesser. So comparing it to like your fried noodles where you are not able to separate the salt because it's already on the noodles, right? Then you already consume the whole amount of sodium. So fish soup gives you the option of not having to finish the soup.
Okay, maybe we can get one more last question due to time constraint. Okay, come to something related with salt. Also, we eat or use every day. Is pink salt, Himalayan salt, ionized salt really good compared to other salt?
So I think there's been a lot of promotion on like salt alternatives. So in terms of salt, everything is salt lah, right? So it's just how much you're adding in. It's not very true that pink salt, Himalayan salt, ionized salt is better than like normal table salt. Especially if you have other conditions. So a lot of the low sodium salt alternatives that they promote, actually what their alternative is potassium. So if you're having conditions like kidney disease, then that would definitely not be an option for you. So it's all about how much you're putting in. So whether you take pink salt, whether you take normal table salt, is still limited to 1 teaspoon a day.
Okay, Ken. So thank you, Miss Yumi, for all the questions and answer. And don't worry, we will back end and answer the questions accordingly. Once again, thank you, Miss Yumi, for sharing with us.